Hi friends, today I'll show you a very short video of polypectomy by hysteroscopic tissue removal system. Conventionally, all of us do hysteroscopic polypectomy using either scissors or sometimes we use resectoscope. HTRS is a novel way of not only cutting but retrieving the tissue at the same time. So after cutting the polyp, we don't need to struggle to pull the polyp out with an ovum forceps or with a dilator. And so this is a very short, very easy procedure. So as you can see, this is the transvaginal scan of the patient right before the procedure. There is a large polyp almost 2 centimeter in size which is arising from the anterior wall of the uterus and it is filling the entire cavity. In such a polyp, trial for pregnancy is almost impossible. When we put in a hysteroscope, you can see this polyp is covering almost the entire cavity and it is arising from the anterior wall of the uterus. We inserted the hysteroscopic tissue retrieval system and we put on the suction and then we start cutting. What HTRS does is that it has something called as mechanical morcellation. So there are blades which cut or slice the polyp into small bits, and there is a suction mechanism which is attached to the HTRS. So here you can see the blade. This blade is not only cutting, but because of the suction, the polyp is also simultaneously getting almost sucked out. So there you go. Within a span of 30 seconds, almost half of the polyp is already out. What you have to remember is all of this is going into the jar of the suction, and then you have to filter the contents and take out the tissue bits and send them for histopathology. So the tissue will be sliced, but it will be easily possible for you to filter and send this tissue. So in a span of almost 30 seconds, this large polyp is not only removed, but it is also completely out of the cavity. The one beauty is that the pedicle can be very nicely dealt with so that there is no recurrence. One thing that bothers us about polyps is that they keep on recurring, they keep on happening again and again. But here you can see this is the pedicle of the polyp, and using the HTRS, I am trying to remove the pedicle entirely at the base so that there is almost a zero chance of recurrence of this polyp. Definitely a polyp can occur elsewhere in the uterus, but my experience with HTRS has been that I have never seen a recurrence of the same polyp growing after a hysteroscopic tissue retrieval system removal. The whole process takes a very small time. The blades, at least the polyp blade, can be reused for at least 4 to 5 cases. There is also a myoma blade, and that has a shorter life. It of course also depends upon how tough the myoma is. So HTRS has changed my life. It has made polyp removal beautiful, very easy, and something which we can do as an office procedure also. Thank you so much. Do leave your comments and your experiences about the HTRS. If you have any doubts, do let me know in the comments. I'll make a subsequent video explaining that. Thank you so much.